If you're over 50 and you're struggling with a stiff or painful mid-back, here's how to fix it quickly with 3 simple exercises and how to stop it from coming back. Alright, do these exercises in order. This first exercise loosens muscle tightness in the mid-back, and this gives a lot of people instant relief, but it also makes the next 2 exercises more effective. To do that, stand 30 centimeters from a wall and place a tennis ball against the wall at the bottom of that muscle tightness, just to one side of your spine. Cross your arms, look down and round your back, and then bend your knees to roll the tennis ball up and down that band of muscles. Your backside should not touch the wall. Do this for about 1 minute on each side of your spine, once or twice a day, making sure that the tennis ball runs over the muscle, not the bones of the spine. It should feel like a firm massage. If there's any sharp joint pain, stop. People over 50 tend to get very rigid mid-back joints, and this joint restriction is the underlying cause of pain and stiffness in this area, so next we loosen up those joints. Rotation is the best way to mobilize the mid-back, so sit forward in a chair, straighten up your spine, place one hand on the outside of the opposite thigh, the other on the back of the chair, and then simply twist your body to look behind you. Hold for a second, then twist the other way. As you twist, breathe right out. Keep your body nice and tall as you rotate, and repeat that 5 times on each side, once or twice a day. The reason we get such rigid mid-back joints is from spending too much time with a rounded mid-back. So we finish up by stretching our back the other way. The simplest knee-friendly way to do that is against a wall. Place your hands at chest height, stand back from the wall, and bend at the hips to lower your chest down until your hands, shoulders, and pelvis form a line. Breathe right out and hold this position for 5 seconds, and then repeat. Bending your knees will help to keep your back straight. Look down, not at your hands, and if your shoulders hurt, put your hands further apart. You should feel a nice stretch in your lower mid-back, but no pain. Repeat that 5 or 6 times, once or twice a day. Now, if you've got a particularly stiff back, you might need to do something a bit more powerful to loosen up those mid-back joints. So to do that, roll up a towel so that it's loosely rolled and about the width of your fist. Then sit on a firm surface with legs bent and lie back over the towel so that it runs down the middle of your spine here. Then just relax your arms out to the sides. If the firmness and the size of the towel is just right, you should feel a nice stretch over the towel. If the towel is rolled too tightly or too big, it'll feel uncomfortable. If it's too loose or too small, you won't feel any stretch. Relax over the towel roll for 1 minute once a day. One main thing tends to cause mid-back pain over 50, and that's sitting with a rounded mid-back. So if you want to make sure that your pain and stiffness doesn't come back, make sure you do these 3 things. Avoid a gap behind your pelvis and move right back in your chair. Put a pillow behind your mid-back to maintain a proper back arch. And never sit in bed or sit with your feet up, because sitting with your feet in front of you rounds your mid-back more. Now, there are other common causes of mid-back pain, like the way you lie in bed or a common way of sitting on the couch, so I recommend that you watch this video next.